outreach program intends to reach our clients in the community, and these programs are there for those who are coming from far, people who are over 75 kilometers away from the facility. And so these programs are there in place, and we do them by ensuring that we take all our services from the center to a particular community, and from there the registered clients can come and be worked on. They can come and receive a service without incurring a lot of costs of transport from wherever they are to where we are. So the program basically is there to ensure that we take our services closer to our clients. And in the same outreach, we are not looking at only the registered clients per se, but we also receive new, because we are collaborating with AIDS Information Center, which is basically there to do HIV tests. So as we go for a particular outreach, we are going with these people. And when they are there, they are also carrying out the tests. And those who are tested HIV positive are sent to us. So we are receiving ongoing clients at the same time. We are receiving new people who are joining the organization in terms of receiving the free services.
TASO has an ambitious mission statement which they are dedicated to. After 2 decades of challenging service, they hold strong to eradicating HIV.
For us, we see that the future in TASO is bright, I would say, because looking at our mission statement and our vision says a world free of HIV and AIDS. For us, we are looking at 10 years from now, the problem of HIV may be solved. And although we are HIV based, we are not worried. What if tomorrow a vaccine is discovered? No. Ours is, if it can happen, then we shall all raise up and start clapping. Although many people will lose their jobs, but we are sure we would have made our vision as an organization.
Unlike TASO, WUDA is a small NGO that fights HIV/AIDS from the grassroots level. HIV prevention was spearheaded by small local NGOs that were educating their peers, reducing stigma regarding HIV/AIDS, and opening up discussions about sexual topics that were previously taboo. In 2002, the number of NGOs involved in HIV/AIDS activities reached 1,300. Thus, WUDA emerged to bridge the gap between what the government provides in Uganda and the unmet needs of the community. WUDA found that government programs were all vertical based on assumptions that communities are weak, poor, and have no potential. They discovered tremendous untapped capacity in rural areas, only lacking empowerment and a few external resources.
WUDA started a few years ago because we, as mainly health professionals who had come together with the people working in other fields, felt that as much as we work in the public service, there was a gap somewhere which was not being covered by the government services that needed to be covered by the non-government service. So we came together, put our heads together, and we said, no, let's start up. It's time to start up an organization that can offer services that are not being offered in this region by government.
WUDA is located in Uganda, which is in southeast Uganda. The resources here are limited, and it's a region often forgotten from the governmental and non-governmental sector. Due to their location, WUDA faces many challenges as there are converging factors that increase the risk of HIV transmission.
One is we are along a highway, a major highway from Mombasa through Kampala to Congo. That brings the epidemic closer along the highway. And the Uganda HIV epidemic, first of all, was along those highways. Then two, Uganda is quite a densely populated district. So in other words, there are many people at risk. Three, there are not many programs for young people therefore they are at high exposure. When they have free time, they don't have other activities to preoccupy them. But also the issue of polygamy. There are men having many wives, and I don't know whether wives also have many, but that kind of practice. Maybe the other contribution is really are not many programs for prevention. Uganda is not one of those districts where there are many NGOs and other partners working on HIV/AIDS prevention.
In order to help combat the HIV epidemic, WUDA focuses on the most vulnerable groups, women, children, and the youth. WUDA has developed a center for youth which enables them to come and spend their free time, keeping them occupied and out of trouble. WUDA staff counsels them on safe sex and reproductive health in order to prevent HIV transmission. In addition, WUDA motivates the youth to promote and use their talents.
We are bringing the youth together into an organization where we're able to provide them with health education and promotion. In future, we intend to start a clinic where they could do testing and treatment for HIV care.
Since the youth have been at WUDA, they established a music, dance, and drama group. This group stemmed out of the staff's encouragement to explore and utilize their talents. MDD's mission is to educate youth, communities, and all of Uganda on HIV prevention and care.